Good morning. I am Monique Anderson Walker, Prince George's County Council member from District 8. Thank you so much for joining us today and are moving forward from the shock of our new reality. Over the last several months, our lives have been turned upside down as a result of this sudden and shocking revelation of COVID virus and the impact that it has on so many lives. We recognize that it's so important to introduce this moving forward through the shock so that we can develop coping mechanisms in our quest to get back to some normality. We have with us tremendous guests with us today, 4 experts who will help us to work through some of those mental challenges and angst that we may all have. And it is my pleasure to have them come and speak with us today. We also are interested in making sure that the topics on mental health that are discussed in this hour are those which we will continue to utilize and take these coping mechanisms as you move forward. Thank you so much for joining us today in the launch of this Moving Forward series. We look forward to continuing the series as well. Remember, we're all in this together. Now let's meet our distinguished guests. We'll start with you, Monica.
Well, good morning. My name is Dr. Monica Green. I'm a clinical psychologist. I specialize in couples, premarital counseling, families, individuals, adolescents, and children. I've been in practice now for about 15 years plus. I have a private practice and run a clinic in Upper Marlboro area. So that's me.
Fantastic. Dominic?
Good morning. My name is Mervyn Dominic Riley. I'm the CEO of the Riley Resource. The Riley Resource is a consulting company that does strategic planning and community engagement for outpatient mental health agencies. So I've worked in the field of mental health and behavioral health for about 14 years now in Prince George's County. I've collaborated with state, local, and nonprofit entities within the county. During that time, I've been able to work with youth and juvenile detention, suffering from homelessness, from addiction, victims of violence, and those in need of mental services. These experiences allow me to have the understanding to assist these children in facing the challenges and allow the opportunity to develop solutions that can impact their lives.
Fantastic. Courtney.
Hi, good morning, Councilwoman. Thank you for having us. My name is Courtney Phillip. I am by trade an ER nurse. I've been an ER nurse in the tri-state area for the last 19 years. Recently, I have graduated and received my degree in family nurse practitioner, where I'm pending board certification. Currently, I work as an administrative nursing supervisor at a local Ward 8 community hospital, as well as in the District of Columbia. Thank you for having me.
Fantastic. Thank you for being here. And Tyrese McAllister. Did we lose Tyrese? You're muted. There you go. Oh, no, you're still muted.
I shouldn't be.
There you go.
There you go.
I'm Tyrese McAllister. I am the owner of Clinical Forensic Associates here in Upper Marlboro, serving the DMV, and I have about 25 years experience working in with people who are experiencing trauma and emergency mental health.
Yeah, well, blessed to have all of you all here today. There's no question we need guidance as we look back on the events of really just yesterday with police officers detaining and killing somebody. We recognize that people are really teetering on the edge with some of their mental challenges, and this COVID period may have pushed them to acts that are unacceptable. But I would love to talk about what you're seeing with regard to behavioral changes, maybe even just from the isolation of having to be home through COVID. And anybody can start. Since we have you, Tyrese, would you start off with that?
Certainly, we are seeing people who are experiencing trauma as a result of COVID, people who are isolated, who are lonely, who are not attending to their mental health needs. I think the system has done as best as it could in providing teletherapy and making sure I know in DC, the CSAs are making sure people get their medications, delivering them. However, people are still, it's the unknown. And so people really don't know what to do. And even service providers are sometimes at a loss of trying to help people deal with this, because for us too, it's very new. So we're just trying to make sure that we're doing all that we can. So whether that's telephone check-ins, video conferencing, ensuring that people get their meds. Prince George's County has an emergency mental health crisis response system. So that's been in full effect, and people who work in emergency mental health are still going out and going to people's homes. So they're also considered like first responders to everyday mental health crises.
Fantastic. I'm going to turn it over to Chris at this point to move forward with the questions. I just would like to, at the end, make sure that you all give out your contact information so that people can reach out to you directly should they need mental support, or just to have conversations or find out what other resources you all can help them to get during this period of time. Thank you again, Chris. I'll let you take it from here. Thank you all for being here.
Thank you.
Thank you.
Thank you, Councilwoman. Again, my name is Chris Valentine. I am the Communications Specialist from the District 8 office. It is a pleasure being your moderator today. First question is geared towards Courtney in regards to medical and first responders. The question is, my wife is a nurse and I have never seen her as tired as she is now. I know she is mentally and physically exhausted. She knows I am concerned about her, but I feel like she needs more from me now. I just don't know what. Can you help me?
Absolutely. That is a very good question. I can speak to that question on a personal level. As Tyrese mentioned before, this pandemic is something that we've never seen before. So the frustration is learning in real time and trying to help the patients, the community understand. And it's a little frustrating when the recommendations change on a daily basis. So the best thing that the husband can do for his wife is listen to her frustrations and concerns about, her work day, because, I hear it from other staff members, they feel like management don't exactly hear and understand because they're not working alongside of them, while they have other responsibilities and duties to try to keep the staff safe. The stress comes on the bedside nurses. We're seeing people die at a more rapid pace, and those people, the frustration also comes with the family when the family can't be there to support the loved one at their last moments here on earth. So just being there, listening to the frustrations, also for workers in any facility, the Human Resource Department offers grief support that is free of charge to workers. So they just need to reach out and get those supports from their facility.
Absolutely. And still kind of riding along the topic of relationships, this next question is geared for Monica. If you can elaborate on this question. The question is, my husband and I were in a good place with each other, had ups and downs, but since COVID-19, we are struggling to be even in the same room together. It's been like this for a few months now. I'm living with a person. It's like I'm living with a person I never knew before. Not sure how we can get back to us. Can you share some tips on that?
So this pandemic has changed our lives. COVID-19 has changed everything about who we are as people. So we'll never go back to being the same person again. You're both different people now. I suggest that you reconnect as the same. Reconnect in and rekindle what made you fall in love with each other from the beginning. Remember why you fell in love. Remember the things that were important to you at that time. Try your best to reconnect. Maybe do some things as a family, perhaps going out for drives, just the two of you, doing some things that you used to do. go to places that are free, and do some things like driving movies, and just taking a drive with each other, just reconnecting on a different level that you've connected on before. But you will never be the same because this pandemic has changed all of our lives. So just trying to support each other. Communication is key. Trying to have family time, just the two of you, and just having the opportunity to share with each other what's going on and how you feel like you can move forward in your relationship building.
Absolutely. And with that being said, a lot of folks are feeling frustrated at this time. And this next question falls to Tyrese in terms of substance. There's a question that states, not being able to get what I need to make me feel better has been getting me depressed and angry recently. It's gotten worse and I don't want anyone to find out. What can I do?
So that's one thing that we're seeing with COVID-19, that people have increased their drinking, people have increased substance use. Sometimes it's out of boredom, loneliness, the isolation is getting to people. So people are struggling with this epidemic. The problem is that the issue is, the solution is that there are other things people can do. This might be a very good time to reset, to talk to someone about you using substances. There is telehealth that's available. The crisis center is available. People can come to your home and actually talk to you, or you could talk to people over the phone or through video conferencing. This might be a very good opportunity to reset and be able to talk about the issues that are bothering you currently, and even how you started. Maybe you started off recreationally. However, because of the situation, your substance use has increased. And so it's going to be important for you to not fall into that trap, because this is the type of epidemic that can create a lot more problems for people who are misusing substances, including alcohol.
Absolutely. And this last question is geared towards Dominic in terms of youth. The question states, my children are frightened to go back into the world. They tell me I am to protect them and they don't want to die. It breaks my heart. What are ways I can do that long term?
All right, so a lot of the associated with COVID-19 is the uncertainty of what's happening from day to day. So the best way that a parent can allay those fears in their children, first of all, is to make sure that they as the parent have the most amount of credible information as possible. So go to the CDC, the World Health Organization, reputable information sites where they can learn about what's going on, so that when they come to inform their children, that they'll be able to have a surety when they speak, as opposed to being doubtful and being in the same mental framework that the children are in. So that would be giving them information about the virus itself, how it's transmitted, and what the procedures and why they're being implemented, and what is the outcome that they're looking based on that. Make sure that you talk to them, any questions that they may have, and pay attention to the information and what they're seeing and what they're hearing on TV. Like, that makes a big difference of how their mentality is developed as they go along with this uncertainty. As long as they have an information base that they work off of, you can pretty much mitigate what they're looking at on TV. Then you have a better outcome going forward, as opposed to them just getting information from their friends, off the internet, online, all these sites that are not reputable.
Absolutely. And one more time, if you can kind of reiterate on kind of what they filter on television and how they receive information. I feel that was a very key topping point that you can further stretch on.
So if you're not sure of your information that you're receiving, and that's for adults and that's for children, then there's a certain amount of doubt, a certain amount of fear that can start to grow as a result of the little piece of misinformation can grow into a whole phobia. You can be locking yourself in a room, just scared. And if a parent has that, then that's definitely going to be transferred to the children. Then you have a whole house of people that become mentally unstable. So if a parent is able to communicate to the children in a calm tone that's reassuring, they're able to reassure the children if they have fears, listen, it's okay to come talk to me. If I don't know as your parent, I'll be able to go and let them work on their own devices. That's how they can feel better if they on the video game for 12 hours during the day because you are scared to talk to them, that kind of stuff. And then pay attention to what it is that they're doing, looking at on television, what they're doing online, and just monitor them, not to invade their privacy, but just to monitor and make sure that they're being safe with the stuff that's going into their information base.
Communication is key.
Absolutely. Absolutely. And Monica and Courtney, this is geared towards you. Real quick, this is a two-part question. The first question is in dealing with this period of trauma, that people are scared to even leave their homes in order to get necessary supplies. And with all this constant turmoil and recent deaths in the news, how have first responders even been affected by this?
Yeah, that's a good question. As I mentioned before with the first question, it is difficult, whether you are a firefighter, EMS, or you work in the hospital. The unknown, as Dominic said, is very scary. But I would also like to piggyback that I totally agree about educating yourself. You would hope that the information that you're seeing on the television is valid information, but it's very important to educate yourself. And that's what, we try to do as first responders as well. Emphasize those guidelines that have been set forth for us through the CDC and even for the state of Maryland. If you go to coronavirus.maryland.gov, it has a wealth of information, such as hand washing, making sure that you wash your hands at least 20 seconds. Soap and water is the best thing to do, but if you don't have soap and water, making sure that you use hand sanitizers. And the information in CDC and the Maryland.gov supports and verifies that the sanitizer with at least 60% alcohol is the best. So just educating yourself about hand washing, hand hygiene, covering your mouth during coughing or sneezing, and wearing the mask. That's the most important thing. While there's controversy on whether the mask protects you, it does provide some sort of protection for you. So wearing the mask is of great importance. So as a healthcare worker, it's important that the community educates themselves about how to stay healthy, to protect other community members, and to protect their families and the healthcare workers, because we are in great risk of being in the vulnerable population of contracting the disease. But we do have personal protection equipment to help us, but it will help as well if the community does their part in trying to protect and the spread of COVID-19.
I agree, Courtney. I think knowledge is power, and fear of the unknown is the greatest fear of all. In private practice and in group practice, we've had the opportunity of seeing clients face-to-face as well as telehealth. But face-to-face, we make sure everyone has on a mask. We're also taking their temperatures. We're encouraging people to wash their hands when they come in, wash their hands when they leave. We are also sanitizing everything, doorknobs, seats, every place that someone has sat, and so forth, just to try to keep them safe, us safe, because we all have the same fear of getting COVID-19. So safety is something that needs to be practiced. We say in the hospital setting, standard precautions. So I think we definitely need to do standard precautions at all times.
Absolutely.
Mhm.
Absolutely, and very, very elaborate and powerful statements right there. Really appreciate that feedback. We actually have a question from the councilwoman herself. Councilwoman Anderson Walker, if you can unmute yourself.
This is absolutely fantastic. So I just want to thank you. You all are phenomenal and very helpful. You know, I recognize that sometimes when we are in situations that we don't have control, it's good to figure out what you can control and really work on that. And it could be taking this period of adversity to figure out what your next steps are. Get your 5-year plan together. Sometimes we're so in the moment of crisis that we don't think beyond the crisis. So in really looking at life after this shock, we need to look forward. We really do need to be looking forward and moving forward, you know, as suggested. But I just have some suggestions too, which I think has worked for me. Mentally, for me, I have to be busy or I will focus too much on stuff I don't need to be focusing on. I planted a garden. I have not successfully done that in the last years that I actually had a garden. But there's something so satisfying about seeing the start of something and seeing it grow through its phases. And it definitely it puts a positive focus on the now as opposed to the crisis. The other part of it is, you know, moving forward, people should be thinking about, hey, what are some of the needs that are out there today that weren't out there before? You know, and figure out your next steps. It could be for a business. It could be how to make life better for other people. But I think it's important to be productive during this period of time. And even though you're home for several months, don't just be home. Be productive. Purging is another big mental weight. You know, when you purge, when you throw away what's not necessary, when you give away what's not necessary that somebody else can use, there's something very liberating about that. And I think it takes a lot off of one's shoulders and off of their mental, a lot of mental weight off of them too. So as we talk about like mentally moving forward, sure, take the precautions that you need to take with regard to, you know, hand washing and the hygiene, but keep moving forward. Keep thinking about what do I want in 5 years? Don't be too much in today, which is probably backwards. People to say live in the moment. Definitely live in your moment, but do it in a positive way.
Right.
So anyway, that's what I wanted to share, and just thank you all because I'm going to mute again so you all can continue. I don't want to be too disruptive. The questions are great, so please proceed, Chris, and thank you all for these answers. It's tremendous. Okay, thank you.
Absolutely, and we really appreciate that, Councilwoman Anderson Walker. That was phenomenal, and I think that is a very strong tipping point that one must definitely take this time to take full advantage of the opportunity. We have a raised hand, and there are a few questions that have actually circulated in the chat. Let's see, we have Otis Ava, who has a question, and I believe this is geared towards everyone. My mother is struggling with depression, such as COVID-19, being older, and I believe has or is developing dementia. She has a doctor and is on antidepressants. I believe she needs an intervention to even get her to see the doctor and get the care that she needs. But it seems to be bothering her. Do you all have any suggestions or any suggestions on how to intervene on this situation? It's kind of written a little different.
This is Tyrese. I would suggest that you try seeing if her primary care physician can do a teletherapy appointment. Most people are doing those now, whereas prior to COVID, they may not have, but this is a good opportunity if she won't go to the doctor to have the doctor at least still be able to engage her. make sure that she is taking her medication when she's supposed to, and then try to create some things for her. If she's able to get out of the house, one of the things I notice with older people is they are staying indoors, which means they are not getting any sun, any vitamin D, which is crucial for people who have depression. So even though we are on the cusp of spring and fall, spring and summer, not having that sunshine could, promote seasonal affective disorder, which is where people are not getting a lot of light. Because people are home, they're more prone to stay settled, sit in a bed or, on the sofa and watch TV. Too much news. So kind of, watch the news, but then watch something else that might be a little bit more joyful, or participate in some kind of activity like cooking, reading, sewing, crocheting. There's some things that people can do from their home. Scrapbooking is a very good one, and that kind of helps people go down memory lane, look at the photos they have. Maybe nowadays we don't print photos, everything is on our phones. So for the adult daughter or son, you can print some photos from your phone and start putting them in a book for her, so that she can have those things and bring about positive memories.
That's excellent, Tyrese. I was actually going to say something very similar, which is that they need to contact the primary care doctor so that the primary care doctor can get involved, who hopefully have some history with that person. When you talk about dementia, one thing that's really good with dementia is structure. So to structure the day with some of those activities that you're talking about, perhaps to get up at the same time every day, to have the opportunity to participate in life with the family and so forth. So what you said was excellent. I echo exactly what you said.
Excellent responses, everyone. And we also have a raised hand from Elizabeth McCreary. We're going to allow her to talk and state your question. Let's find her. Or did she just jump off? Yep, I believe she just jumped off, unfortunately, but we're going to keep things rolling. Tyrese, this next question is geared towards you. Let's see. This is geared towards grief. Okay. My mother passed away from COVID-19, and we had to have a funeral with only 10 family members. It was so cold and not the way I wanted to honor my mother's life. We couldn't stand with one another or hug each other when we were crying. I know all funerals are like this now, but I can't stop thinking of the day and how sad it was on so many levels. Can't stop the pain I feel. I cry every day. What should I do?
First of all, I'm very sorry for your loss, and for all people who are experiencing losses at this time. Experiencing a loss or a death of a loved one makes it extremely complicated during COVID, because we can't honor our normal rituals like a funeral service, support a family. Even the repast is important to us as African Americans, and being able to console each other, come to each other's home and bring food and provide that level of support. And because we cannot do that, we are subjected to something new. I do applaud funeral homes and people in that industry, because they are at least trying to make a way for people to have some type of observation or observance for their loved ones. One of the things that I would suggest is that deal with the reality that it is what it is. Like, it is not your fault that you were not able, that you may not have been able to be at the bedside of a loved one, that it is the circumstances, and that certainly your loved one will understand that you were prevented from being there by their side or being able to give them the burial they may have wanted or that you may have wanted for them. One thing that I have suggested to some of my clients is that you can still do a memorial service later on, and you can do other rituals to observe the person's or recognize the person's death and or what they meant to you in your life, and have other people speak as well. So it can be postponed. It doesn't have to be immediately. And I think people usually observe up to a year, but given the circumstances of COVID, I think people would be okay to do it. So you can do it on their birthday, you can do it on the anniversary of their death. It's just don't like I think Councilwoman Monique Anderson Walker said, think about what you can control and what you can't control. Be able to not hold yourself so accountable for it. But to think about what you can do and how you can still give honor to the person. As it relates to getting support for yourself, I would suggest that you reach out to people, be gentle with yourself, that this type of grief in this time may last a little longer than expected. And I'm asking other people to be gentle with people who've had these losses, because this is different. This is unprecedented, and we don't have a how-to manual on how to handle these things, but to be gentle, to be loving, and to be kind, and to try to be supportive. So phone calls, Zoom meetings, reach out for professional help if you need to. There's nothing wrong with that. And again, there people are doing it through teletherapy, telephone support. There's a crisis center here in Prince George's County. Affiliated Sante has a 24-hour crisis center that can also provide some support. The thing is to make sure that you get the support you need and not be, and people may not know how to ask or what to do, but be able to think about what it is you need and be able to articulate that need to your friends and family.
Excellent response, and we really appreciate that. And as Tyrese indicated, there are resources you can tap into in order to get help. So don't think that you can't reach out. This next question is a two-part question geared towards Courtney, Dominic, and Monica. If we can address sleep. Sleep patterns have been dramatically altered during this period in time. And this is a two-part question. The first question is, my sleep has been horrible since the pandemic started. I have tried calming myself down before bed, playing soft music, drinking herbal tea, and even taking sleeping pills. But I awake tired and feeling drained, no matter how much sleep I have gotten. And the second question is, I am super concerned with no outlets and summer plans, especially after having the last few months of school change so quickly. What are some of the implications we should expect from the sudden negative change in our children and teenagers' lives?
Well, one thing we can do with the sleep patterns, I think all of us have had some sleep issues, certainly clients as well as us as professionals as well. One of the things I always encourage my clients to do is to journal prior to going to sleep at night. That kind of gets it out of your head and into something. It's in black and white. You can deal with it another day. Setting your intentions for the day and crossing them through kind of helps you to relieve some of those thought processes that are, we call them racing thoughts, which actually it doesn't allow us to move on to what's next. So to actually have a chance to write them down, make sure that you're not doing media. Turn off your cell phones, turn off your Facebook accounts at least 2 hours prior to trying to go to sleep, and try to set a pattern for you so that you have an opportunity to experience good sleep. Everyone definitely needs to experience that rapid eye movement, which we call REM sleep. And we certainly need that in order to function and to do our best throughout the day. So actually starting to turn off your media things, journal before you go to sleep, and perhaps try some of the local remedies of sleepy time tea and those kinds of things that could perhaps help you to change your pattern. If you do something for 3 days, like with a sleep pattern, it actually helps you to incorporate these things into your day-to-day processes so that you can experience good sleep. So
I would say on the topic of sleep, a lot of people think that they'll say I'm sleepy, but they'll pick up their phone or they'll get on the computer or they'll turn on the TV. And what that does is the same things that's making you stay up, as far as you being overstimulated and your brain working too much, is exacerbated by you turning on handheld electronic or the TV, because you get the same amount of stimulation, if not more, when you're up. So that actually keeps you up longer than it would normally if you're able to shut all these things down, like Dr. Green said, you're able to do what's called an information dump. So if you're journaling, all those thoughts that are floating around your mind, you're able to capture them, and actually the process of putting them on paper allows your mind to release the responsibility of memorizing it, and it also allows you to relax. So all those things in the process will allow you to go to sleep. In addition, I say that I'll just jump right to the question of the children. You will see that children are now experiencing increased stress, increased attitude, restlessness, anxiety, some aggression, sadness, depression. All things are due to the fear of the unknown. The most important thing for the children, I feel, is that they need to have a structure that was touched on before. So that structure would be the ability for them to have a consistent order of their day. The more things that they have that are structured and coordinated, is less free time that their mind have to latch on to pieces of information that is going to cause all these attitudes and behaviors that are negative. So if they get up in the morning, they know that, okay, I get up in the morning, let's say at 7:30, I have breakfast, or rather I have a little bit of physical activity where I do some push-ups, sit-ups, go for a short walk. Physical activity is definitely needed, in addition to, as Tyree said, them getting the vitamin D by just going outside to combat the depression. A lot of these kids are getting fat in the house because they're just eating. So same thing, little activity. It doesn't have to be the same thing. If they go for a walk one day, they go in the backyard and play some soccer or bike riding or pick up a new sport. All they have time is to explore these kind of things. Make sure that there's definitely a time where they're doing their schoolwork. A lot of kids that I mentor are happy now because they're actually getting better grades in school because there are less distractions with their peer group in the classroom. So kids that have been getting C's and D's and they feel better about themselves. So them going back into school, having good grades is going to change that outlook for that child going forward. As opposed to this time being a negative, a lot of them are able to focus more and understand what it is that's needed for them to invest in their schoolwork to get the results that they want. So a lot of these things, like, it comes down to like structuring for the kids, and that will help them a lot.
I totally agree with you, Dominique and Dr. Green. I personally have two school-age children, and the structure is key. We go about the day just like a regular school day. We have breakfast, we have the curriculum work, then we have break time, and we get back to the work. And it really does make a difference, and not have their mind wandering on a video game or social media all day long. I absolutely agree that having structure helps with the children right at this difficult moment.
Really appreciate those responses, you all. And Courtney, I actually do have another question for you. We appreciate all that you all we appreciate all that you all are doing as first responders. However, words definitely feel like they're enough. What can we do to benefit first responders during this pandemic?
The amount of support that healthcare workers have received during the pandemic is absolutely phenomenal. We greatly appreciate the gestures, the parades that other first responders give healthcare facilities, the prayers. We can't thank you enough. It is absolutely heartfelt. We appreciate it. And right now we're just all in this together. And as I mentioned before in one of the responses, is that the best thing that you could do for us, for your community and your family, is practice those guidelines that have been set forth for us. Washing your hands, wearing your mask, practice social distancing, especially now that counties and states are experiencing their phases for reopening, it's very important to keep those guidelines in mind and to practice them to its full extent to keep everyone safe.
Absolutely. And before we continue, we actually have a raised hand in the chat from Phyllis Cornegay. We're going to allow you to talk at this moment. Phyllis, can you hear us?
Hello.
Hello, Phyllis. How you doing?
Hi, how are you?
I'm good. You had a question?
Yes. As I stated in my question, I'm a therapeutic foster mother. And, you know, we deal with kids that have mental issues. And we have the kids that they're not understanding the importance of this pandemic, staying safe distancing and wearing the mask and just having to be, you know, stay home. So I wanted to know what advice can you offer us to help these kids because they want to run out, they don't want to come back in, and then if you tell them they can't come back in, they get stressed. And I need to get out of here. I need to get out of here. So I need to know what advice can we that you can offer us to help us deal with the situation.
I'd actually just typed your response for your question. I saw you had a question. So depending on the level of care of the children that you're dealing with would determine what your response would be. So again, it comes back. So even with a child that might have some kind of mental disability, the structure is still important and the information is still important. So how you would share the information based on what COVID-19 is and how contagious it is and what the outcomes can be will be based on the level of response, I guess, or, you know, how they would receive the information. Because a lot of times they're young and they feel like they're invincible, but if they have more information, they can make better informed decisions to whatever level that is. I don't know what the level of the kids that you take care. And then anything past that, you can also leverage some community resources. If you reach out to the Department of Health, or if you reach out to pgcounty.org for information where they can tangibly see it and read it and look at numbers and see people infected, people is dying, and all those kind of things where it's real to them, as opposed to you telling them the same thing you tell them every day, hey, come inside before it's dark, and those kind of things that sound repetitive and it doesn't have any weight anymore. Like, those are the type of things that you should try to implement and use to get that information across to them.
Okay, thank you.
I wanted to add too that if it depends on the age of the child, but if you implement things at home, that might be helpful too. Or if there are, you know, one or two of their peers that you feel can come over and they socially distance. Like, for example, children can play the video games with each other and not sit right there together, so they can sit 6 feet apart with a mask. And you can at home, what happens with children is they get bored. Young people, they get bored, and then they are going to lose their mind. The other thing to do is ask them to, you know, or help them with working on their coping skills, because boredom is something adults face and have a very hard time dealing with. Adults are having a hard time staying in home, just like children. But work on the coping skills, work on activities, write a list of things that they can do, what's in their control, some safe activities, like give them at least better options. Not saying that they will definitely do it, but if you give them some options, they at least can say, okay, I can't do this, but I can do that. So it might be safer to have one or two of their peers over versus them going out from home to home and larger crowds. Or is it something, it's the weather is getting nicer? Can they sit on the porch or sit in the backyard and have a conversation, and you condone that, and maybe support it with some lemonade and cookies, something like that, but something to give them the understanding that you get where they are. However, you still want them to be safe.
Okay, thank you.
We appreciate that, Phyllis. Thanks for calling in. We're going to continue. And this last question, because I know we're coming to our peak of time here, but this one just came across my desk. It came to my attention that is a question for all of you, and it's dealing with trauma. This question states, we are currently being held hostage in our home due to a family member with mental health issues. We normally go through the courts to file a petition for emergency evaluation, but we have been struggling to file a petition in fear of the family member becoming sick in the hospital. However, it is coming to a point where we can't even be in the house with that family member any longer. What precautions are the hospitals currently taking in terms of mental health ward because of COVID-19, and how can we de-escalate the members' outbursts and threats? And Tyrese, we're going to start with you.
Okay, so hospitals are absolutely taking universal precautions. As Courtney had said, the mental health hospital or the mental health unit is no different. They are taking temperatures, they are tending to the needs of consumers who come in who may have mental illness and COVID. They are allowed to wear a mask. I know the staff usually does still wear a mask on the unit. As it relates to emergency petitions, if family members cannot be taken care of in the home safely for themselves or for other people, it's imperative that people still go to the hospital. Their risk of exposure is probably less in a hospital because of the consistent universal precautions than out on the street. So I would not personally have a person in and out my home exposing everyone to risk for fear that they may get COVID. And I think the thing, even though people are dying from COVID-19, there are many, and we seem to focus really only on that, but there are many more people who live with it. I think we need to focus on adequate care for the most pressing issue, along with good prevention. So we need to focus on whatever the issue is at hand. I know a family member, well, not a family member, but a friend of a family member, family member who has a history of diabetes and really in a bad situation, wouldn't go to the hospital because of fear of COVID, but you may die of diabetes. And so those aren't the best decisions. People still need to go to the emergency room if they need to, understanding that all emergency rooms are using universal precautions and really trying as best as possible to keep people safe. But we can't neglect our emergent health issues because of fear of COVID.
I agree. I say, first of all, make sure people are taking their medications daily and as prescribed, first of all. Second of all, get in touch with their psychiatrist or therapist to see if you can do a team approach in getting people into a safe environment, whether that's at home or whether that's taking them to the emergency room. If the person does not want to go or doesn't understand the safety of going to the hospital, then you can always call 911 and they will carefully come and evaluate the client and take them into the emergency room. In the emergency room, they will be evaluated by a clinical person there, whether it's a therapist or LCPC, whatever the licensure level is. Once they're evaluated, then a decision will be made and determined whether they need to be on an inpatient unit or they can go back and do outpatient services. And in an inpatient unit, of course, people are using, as she said, standard precautions and universal precautions. But first and foremost is everybody has to be safe. The people at home, the client, everybody has to be safe. So safety first.
Very well said, Tyrese and Dr. Green. I just want to address what healthcare facilities do to keep the staff and patients safe. The first thing is the recommendation has been for several weeks now, no visitors. There is an exception list. So someone who is at the end of life, who will be transitioning soon, that's non-COVID, we have stipulations for, and that's for all hospitals. Also, now walking into any healthcare facility, you are screened. And if you meet any of the criteria that puts you at risk for having COVID, you're not allowed in the hospital. It's just a safety precaution that is nationwide right now. So all visitors, all patients, and all staff members wear masks throughout the healthcare facility, as well as we take special precautions for those who are COVID. So you may be in a room that's next to a COVID patient. No worries, because that room is protected. There's special rooms that the COVID patients go into. Also, if you come into a hospital emergency department through triage and not by EMS, there's screening right at the door there. So if you come in for one complaint, but you meet other criteria, depending upon the time of the day, you're not amongst the general population. A lot of the hospitals have COVID tents that they further triage you in to determine your possibility of needing to be tested for COVID. Another thing that has changed with hospital admissions, most healthcare facilities have mandated that anyone that is going to be admitted to the hospital is tested for COVID. So there are rapid tests that we can get the results back within 30 to 45 minutes to let us know if the patient is COVID positive or COVID negative, and then that patient is placed appropriately. So I must reiterate that if you have a health condition that one you question, you're always able to call and ask advice on whether you should be seen or not. But by all means, do not neglect your health out of fear.
Really appreciate those responses, everyone. And again, really extend our hearts and prayers out to that individual who is currently going through that. We have the councilwoman would like to join back into the call. She would like to reiterate on a few things. Councilwoman Anderson Walker, if you can unmute yourself.
Yes. Again, this is absolutely fantastic. So thank you for your insight and your advice. I just want to mention, I kind of touched on it earlier in my introduction, that the situation yesterday in Minneapolis with the gentleman who was brutally murdered on the street by a police officer, the visual of that, but just the story, is shocking. I mention that because sometimes we have layered issues. You know, we have the challenge of where we are right now with COVID, but then we see a situation of a gentleman jogging in Georgia who just gets shot down. You know, we have this situation from yesterday in Minneapolis, and a lot of children are waking up looking at this, and this has an impact on them. It informs something in them that will shape who they are. So I'm very curious as to how do we deal with these layered issues that we cannot escape. We can't turn off, you can turn off the television, but there's so many other ways for kids to get information. How do we assist them through this? The other part of the question is, I've got 3 children, you know, they're 21, 20, and 14, and they're social. One of them claims she's not social, but she didn't realize how social she was until she couldn't be. And now she wants to see people. But just, you know, help us kind of with what can we do? You know, is it go to a big parking lot and you all look at your friends from a distance? You know, what little things can we do? So those are the 2 questions. How do we deal with these layered issues in society to keep our kids positive? Keep us positive for that matter. And how do we deal with the social interaction that we all need? We all need to feel, touch people. This is exciting for me to see you all. I'm used to seeing you all in person. You know, I'm a hugger.
Yeah.
But this will do. You know, this gives me something.
Right.
Just speak to that. And what can we all do to just keep our sanity and keep connected?
Well, I think when watching the news and we see so much of the issues of death and crime and so forth, I think it's important to communicate with your children about everything. Communication is the impetus of many things. The other piece is just a couple weeks ago, I felt like I needed to see a couple of my friends. So I jumped in my car and went over to a friend's house, and we actually saw each other in the driveway, keeping our social distance, and we actually had the opportunity to socialize. So those are actually great things to do right now. You can't touch and hug, and I'm a hugger too, but you have to do what's best for you, and you have to keep yourself safe. So those types of things do actually work and build your psyche and make you feel much better about the situation and what we're handling right now. What do you think, Tyrese?
I agree on a more micro level to make sure that we're talking, connecting with people through Zoom, connecting to people with those drive-through meetings. Those parades have been fantastic.
Mm-hmm.
I know I'm talking to people that I haven't talked to in years, and I'm loving it. I'm loving the downtown for myself. So I kind of just how I think about it is differently. Instead of thinking of myself as being arrested in my home or on social probation, like what can I do? What kinds of things can I control? But on a more macro level, and to speak really to the incident that happened on Memorial Day, I think what we need to do is become more active in our community. I think that we have gotten away from, we're very isolated in what we do, and not too many of us are as civil-minded as we need to be. When these types of incidents happen, in large, we march, but we don't do anything after the march. We don't have any actionable items that we're talking to police about, or even in our own community, because while the crime against us from police is atrocious, the crime that we perpetrate on each other is just as atrocious. And we have to be able to do something. We have to be able to get more involved. And the thing that I've noticed that what helps me take my mind off of COVID and other things is to do stuff for other people. So checking on people, not focusing on how I'm feeling, makes me feel, by the end of the day, I'm like, oh yeah, was I worried about something? Not as much, because I'm checking on people and talking to other people about what's going on with them, checking on my friends that are first responders. And by the way, Courtney, thank you for your service, because I'm not even sure if I could give that level of service with that risk of exposure for my police officer friends. To focus on what they need and how they're doing really helps me take my mind off of things. But what I would really like to see the community do largely is to become more involved in, reducing crime and murder in our community, because no matter who's doing the perpetrating, at the end of the day, we're losing valuable people in our community. And so there's enough to be done that people can, they need to just do something besides march, because we're not getting anywhere with that.
Chris, thank you so much for moderating. This was an excellent webinar. I learned so much. So I'm sure our listeners listening, we all have so much to take away from it. Thank you all, Courtney, Dominique, Tyrese, Monica. You all really blessed us today. Let me just recoup on some things you said. Reset. I got reset. I love that word. Be gentle with ourselves and with each other, because we're all in this together and we're all dealing with the same fears, the same unknowns. So we have to really be patient with ourselves as well as with others. I heard Monica say we're new people. We're not the same. We'll never go back to who we were. And that's important to remember when we're dealing with others as well. I think all of our relationships have definitely changed, and we've seen that. And I think we've seen our own self changes. Communicate. We always hear that. Communication is always key. And reconnect with people that you have not been talking to. Stay informed. Educate yourself. We have so much information coming in on a daily basis. And I agree. Take time to get yourself informed so you can actually inform your family members and especially your children, as you said, Dominique. Try to stay in the moment on what you can do right now. The racing thoughts, I like that one because I'm a racing thoughts person at night. And, you know, and Monica, you know, we're all up late, so I to kind of disconnect.
Right.
I'm a good herbal tea, but I'm still connected here. I need to stop. So I get that. That helped me. And then also, Courtney, the great advice, which our mothers always said, go wash your hands.
Mm-hmm.
Wash your hands, right? Wash it with soap and water, warm water. We know we need to wash them a little bit more often and use lotion because I've never had dry hands, but my hands now are dry as well. And wear your mask. Big believer in wearing your mask is not just for you, it's for other people. Because if you're a carrier, you might be giving it to someone else. And I think we don't want to be responsible for someone else's illness or death. Tyrese, I mean, the reconnection and the mental health thing, talking about drinking and so forth, trying to kind of get a handle on where you're at with that. Because I think recreational is one thing. And I think probably everybody nowadays, probably some people are like, I need a drink, but put limits on everything. So, I mean, there was so much information, and I know we need to do this again. I want to thank you on behalf of the councilwoman who she might join us. She was not even going to be on because she had some other obligation, but she must have changed up. It was so good. She stayed with us. So I want to thank Chris, and I want to thank all the District 8 and everybody around looking at this. We will be posting this on YouTube and on social media. We'll ask you all to share it out with your friends because I think this was very helpful. Know that we are committed to moving forward together. We're all in this together, but we're moving forward because this is something, as we said, it's going to be with us for a while. The councilwoman is going to be providing these experts series, different ones on mental health, different subjects that we'll be having. So we'll be doing these monthly or maybe twice a month, and we'll be keeping you posted. So God bless everybody, and thank you so much for joining us. Is the councilwoman still with us before we say goodbye? I don't know, Chris, do you see her still, or she might have gone on to her obligation? Okay.
Yeah, I think she's gone.
God bless everybody.
Thank you so much.
Thank you for this opportunity.
Okay. Absolutely. Thank you.
Moving forward, everybody.
Listen, thank you again. Thank you so much.
There she
Awesome.
is.
There she is.
I've been in tune the whole time, but as I mentioned earlier, I am type A+. So, and I said, I can do it all. Budget adoption is tomorrow. So as you can imagine, it's been a very intense couple of months, I'll say that, but certainly down to these last couple of weeks, very intense. But looking at opportunities to be helpful in the community. I know that with all of you all, we've had discussions of how we can use some of our funding to help support your causes, because your causes are directly impacting us. Mental health is tremendously important, tremendously important. I want to leave with this. Trust the process. Nothing's going to be great all the time. Just trust the process. Be faithful and work your plan. So that means you have to have a plan, right?
Right.
But do that. This is a time to get your plan together and launch. Most people launch when they're at their lowest point, right? If you're a rubber band, you got to get stretched down here in order to get that height. This doesn't do much. This does. We're here. Use this as an opportunity to tee yourself up for the next thing that's in your life. Things that you want. Start getting in tune with why you're here. What is your purpose? If you don't know, figure it out. And this is a good thing about life. It will slow you down until you get the point. So let's take advantage of this, and the reset button is so important. So thank you all for your input. We look forward to doing these series again. I would also like to, probably in post-production, have all of your contact information so that if people want to reach out to you, they can. I know that many of you all take insurance. So even for those telecalls, telemedicine, you might take certain insurance for people who are interested in having further conversations that are more clinical in nature. Again, thank you. Be safe and be healthy. We're all in this together.